Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. In assisting preconceptual clients, the nurse should teach that the corpus luteum secretes progesterone, which thickens the endometrial lining in which of the phases of the menstrual cycle? Menstrual phase, proliferative phase, secretory phase, ischemic phase. The correct answer is secretory phase. The ovarian hormone responsible for the secretory phase is progesterone, which is secreted by the corpus luteum and causes marked swelling in the uterine endometrium. A client decided early in her pregnancy to breastfeed her first baby. She gave birth to a normal, full-term girl and is now progressing toward the establishment of successful lactation. To remove the baby from her breast, she should be instructed to gently pull the infant away. Withdraw the breast from the infant's mouth. Compress the areolar tissue until the infant drops the nipple from her mouth. Insert a clean finger into the baby's mouth beside the nipple. The correct answer is insert a clean finger into the baby's mouth beside the nipple. By inserting a finger into the infant's mouth beside the nipple, the lactating mother can break the suction and the nipple can be removed without trauma. Which of the following blood values would require further nursing action in a newborn who is 4 hours old? Hemoglobin 17.2. Platelets 250,000. Serum glucose 30. White blood cells 18,000. The correct answer is serum glucose 30. A serum glucose of 30 in the first 72 hours of life is indicative of hypoglycemia and warrants further intervention. In acute episodes of mania, lithium is effective in 12 weeks, but it may take up to 4 weeks, or even a few months, to treat symptoms fully. Sometimes an antipsychotic agent is prescribed during the first few days or weeks of an acute episode to manage severe behavioral excitement and acute psychotic symptoms. In addition to the lithium, which one of the following medications might the physician prescribe? Diazepam, Valium. Haloperidol, Haldol. Sertraline, Zoloft. Alprazolam, Xanax. The correct answer is haloperidol, Haldol. Haloperidol is an antipsychotic medication and may be used until the lithium takes effect. Early in her 9th month of pregnancy, a client has been diagnosed as having mild preeclampsia. In counseling her about her diet, the nurse must emphasize the importance of decreasing her sodium intake, decreasing her fluids, increasing her carbohydrate intake, eating a moderate to high-protein diet. The correct answer is eating a moderate to high-protein diet. Loss of urinary protein is associated with increased permeability of the large protein molecules with pregnancy-induced hypertension. Additional dietary protein also helps increase the plasma colloidal osmotic pressure. Diets deficient in protein have been linked to pregnancy-induced hypertension. A male client is being treated in the burn unit for third-degree burns on his head, neck, and upper chest received in the last 24 hours. The nurse is evaluating the effectiveness of fluid resuscitation. Which of the following indicates effective fluid balance? His weight increases from 165 to 175 pounds. His urine output is equal to his total fluid intake. His urine output has been greater 35 milliliters per hour for the past 12 hours. His blood pressure is 94/62. The correct answer is his urine output has been greater than 35 milliliters per hour for the past 12 hours. A urine output greater than his intake indicates that he is receiving adequate fluid resuscitation to account for urinary and insensible losses. A male client seeks counseling after his wife of 19 years threatened to divorce him. For most of their marriage, he has physically and verbally abused her. When asked about his behavior in the process of the nursing assessment, the client states, "I was mean to my wife because she insists on cooking meals and wearing clothes that I do not like." This defense mechanism is an example of repression, regression, reaction formation, rationalization. The correct answer is rationalization. Rationalization is unconsciously falsifying an experience by giving a rational explanation. The client is attempting to justify his behavior by giving an explanation. A 5-year-old has just had a tonsillectomy and adenoidectomy. Which of these nursing measures should be included in the postoperative care? Encourage the child to cough up blood if present. Give warm, clear liquids when fully alert. Have child gargle and do toothbrushing to remove old blood. Observe for evidence of bleeding. The correct answer is observe for evidence of bleeding. Postoperative hemorrhage, though unusual, may occur. The nurse should observe for bleeding by looking directly into the throat and for vomiting of bright red blood, continuous swallowing, and changes in vital signs. A 4 days postpartum client who is gravida 3, para 3, is examined by the home health nurse during her first postpartum home visit. The nurse notes that she has a pink vaginal discharge with a serosanguineous consistency. The nurse would most accurately chart the client's lochia as rubra, rosa, serosa, alba. The correct answer is serosa. Lochia serosa is a pink-brown discharge with a serosanguineous consistency that occurs 49 days postpartum. A male client had a right below-the-knee amputation 4 days ago. His incision is healing well. He has gotten out of bed several times and sat at the side of the bed. Each time after returning to bed, he has experienced pain as if it were located in his right foot. Which nursing measure indicates the nurse has a thorough understanding of phantom pain and its management? Phantom pain is entirely in the client's mind. The client should be instructed that the pain is psychological and should not be treated. The basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. The cause of phantom pain is unknown. The nurse should provide the client with support, promote sleep, and handle the injured limb smoothly and gently. Phantom pain is caused by trauma, spasms, and edema at the incisional site. It will decrease when postoperative edema decreases. It should be treated with non-narcotic medication whenever possible. The correct answer is the basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. Phantom pain may be caused by nerves continuing to carry sensation to the brain even though the limb is removed. It is real, intense, and should be treated as ordinary pain would. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.